My name is Annette Beautrais and I work currently as the Suicide Prevention Coordinator for the South Canterbury DHB based in Timaru and going up to Twizel. But I have spent many years working in suicide research and education and suicide prevention based in Christchurch, but also working internationally.
So what are some of the signs that people can watch out for with their workmates and friends?
So if you are working alongside someone or you know someone very well in your neighbourhood, or you have friends or family members who may be distressed or depressed or overwhelmed or facing some of the current challenges that many people are facing these days, then you are in a very good position to look out for changes in their behaviour. First of all, you need to be aware of what's going on in their lives, and often people are stressed and overwhelmed and depressed when they are facing particularly challenging situations. So it may be something such as a relationship breakup, or the threat of a relationship breakup, or custody issues, or the death of a family member or close friend, or a financial loss, or problems at work. It's often about a loss of some sort. So if you bear that in mind, you're aware, if you work alongside someone, if you know someone in your community, what things are happening in their lives. Just be alert if they are suffering losses. And then look for changes in their behaviour. So they may become more moody or withdrawn or isolating, or drop out of sports teams or activities, don't want to go out for a drink after work, something like that. They may not come to work at all. They may have more sick days than usual. When they do come to work, they may be less productive because they're consumed with trying to sort out their problem. Some people may react to stress by becoming more irritable, so they may be more snappy than usual, more likely to become quickly angry. Some people may be depressed, may have difficulty sleeping. Some people may drink more, use more drugs, vape more, those sorts of things. So look out for a loss and look out for changes in people's behaviour. And then there may be things that you may sense. So you may sense that someone feels very alone, that they feel very hopeless. Always trust your gut, always trust your intuition. Even if you can't put a label on it, you're usually right. Those are the sorts of signs to look out for.
So what can people do to help support their workmates or friends or family who may be struggling in these ways?
The first thing I would say is, if you ever get the opportunity at work or in your community to do a 3-hour Mental Health 101 or a Good Yarn program, which is Mental Health 101 for the rural community, then do take the opportunity to do it. It's just an introduction. It's not going to make you a psychologist or a counsellor in any way, but it's a very good basic introduction to depression and anxiety, the common responses when people are stressed. And it also gives you the opportunity to learn how to approach someone and have a conversation about mental health, which for some people is a really scary thing to do. And going to one of these courses will give you the skills and the confidence and the permission to approach people. So always approach people when they're in a private situation. You don't want to raise these issues in public. Often it's helpful to go for a walk with someone. It's not as confronting if you are walking side by side. A good place to have a conversation like this may be in the cab of a truck or a ute or a car. And those of you with teenagers will not recognise this. Mum, could I ask you about something? So bear that in mind. And then a very good starting point is to say, look, I'm worried about you because. It gets you a very long way, and what you can then say is what it is in terms of the behaviour changes that have made you worry. I'm worried about you because you've missed a lot of work lately, and I know there's been some stuff going on at home. And say, look, sometimes when people are facing challenges like this, they're going to get upset and distressed and depressed and overwhelmed. That's everyone's typical response in these situations. But some people may get so upset, they might even think about suicide. Are you thinking about suicide? So if you structure the conversation in this way and you use what I've just said as a model script, you can apply that to almost any situation. You can adapt it. So just to go over it again, I'm worried about you because of what I've noticed. Look, anyone going through your problems, understandably, is going to be distressed, be depressed, be overwhelmed. Some people may get so distressed they may even think about suicide. Are you thinking about suicide?
So here in Southland, what are some of the local pathways for accessing help?
There are a lot of sources of help available. Many of them are available 24/7, and many of them actually provide free counselling. So first of all, there is the National Mental Health Helpline number, which is 1737, free text or call, and it's available 24/7. It's staffed by experienced mental health counsellors, mental health nurses. They will take calls in over 40 languages, because often it's much easier to talk to someone in your own language rather than to talk to people about mental health issues if English is your second language. So 1737 is available, and don't hesitate to call 1737 if you're not sure what to do, but ring them up and say, I've got a friend or I've got a workmate I'm worried about, what should I do? And they will respond appropriately to that. There is also Youthline, and anyone under 25 can call the Youthline number. Youthline also has a text message service, text 234, and they also have a web chat service on their website. And you remember that your GP is your referral hub, so go to primary care provider and they can refer you to brief intervention counselling services, and you're entitled to 4 free sessions a year from the brief intervention counsellors. And many GP practices now have health improvement practitioners, sometimes called HIPs, and health coaches co-located within the primary care surgery, and their services are available free as well. Many employers offer employment assistance or EAP services, and again, that's free counselling that's available to employees. In a mental health crisis or emergency, you can call your local 0800 DHB crisis team number, and that's readily available in resources for Southland. And in an emergency, don't hesitate to call 111. Police do a lot of work in terms of providing emergency responses to mental health issues. And a 111 call, they will triage whoever is necessary, fire and emergency, St John and police. And in some cases, we can actually save people just by making that 111.
So there's a lot of discussion around whether or not talking about suicide is beneficial or could be detrimental. What's your take on that?
I think that very unfortunately, with the best of intentions, we have normalised suicide in New Zealand by talking about it extensively. And we need to distinguish between talking about suicide as if it's a common occurrence, it is not, and asking someone who's distressed and we're worried about if they're thinking about suicide. Those are two completely different things, but we really do want to minimise the normalisation of suicide. So what we really want to do is not focus on talking about suicide, but what we really want to normalise and encourage is help seeking and help offering. Help offering is really important, and I go back to what I said in the beginning. If you get the opportunity to get some skills around how to ask people if they need help, and you know how to link them to appropriate local pathways for help, that is the most important thing that you can do. And very often, in any community, the best thing you can have is a caring person with a little bit of information, the right information, in the right spot at the right time. So promoting help offering, encouraging help seeking, and minimising just detrimental discussion about suicide is the most important approach.